I'm Kelly Henderson. I am Executive Director of Formed Families Forward.
So what inspired you to get involved with Formed Families Forward?
Sure. So Formed Families Forward was founded in 2011, and I was one of the group of women, all moms through foster care and adoption, who realized that despite having lots of resources in our area, and despite us personally having lots of professional expertise and familiarity with rules and laws and regulations and policies, that our children with special needs were still not getting what they needed, particularly in school, but also in our behavioral health or mental health system. So there's a lot of frustration by this group of moms. We sort of banded together, and we had an attorney, we had a special education experts, we had a nurse, and collectively we decided to create this nonprofit where we were initially just providing pro bono services to child welfare agencies and other foster and adoptive and kinship family members who were struggling to get their needs met.
For you, I was doing research, and you've done a lot for kids. What is it like helping kids?
Helping kids and families is the core of what we do, and it is essential to making foster, adoptive, and kinship families successful. So if we're not reaching families directly, there's missed opportunities, and the outcomes for kids just are poorer. And so it's really important for us to be able to work directly with kids, directly with families, and use our personal lived experiences also to provide those peer supports.
Yeah, how does your program help the confidence of not only kids, but their families as well?
Yeah. So, I mean, there's that old adage of knowledge is power, and it really is just so true that our systems, our service systems, and education and behavioral health and mental health and the court system and child welfare and other social services are just very fragmented. I know Northern Virginia is not unique in that, but it is really a challenging system to navigate. So I think us being in a place, again, from a peer perspective, to be able to share our lived experiences, but also help those families navigate services and supports, understand how those systems are supposed to work together, and really give tools for them to advocate to improve outcomes for their families, to make those connections, to ask questions that they didn't know they could ask or should ask about those services, to say, hey, what about this service or that service, or why have these two dots not been connected for my kid yet? And that's really important. It puts the family then in the driver's seat. It puts the child, front and center, rather than the system sort of steering the boat.
So with the organization, you do a lot to help others, but what do you do to help your own mental health?
That's a great question. So we talk a lot about self-care and really finding ways to regulate within your own self, within your own family. And so I think I hope that we recognize that as staff members of this organization, that we need to do that. We need to prioritize our families and prioritize ourselves, but then also be able to be nimble and helpful in responding to other families. So personally, I have my own kids, and so I do a lot of things with my kids. We bike and we walk dogs, and we attend Special Olympic events and do a lot of things in the community. But I relish a little bit of quiet time once in a while myself, getting a good book that has nothing to do with the work world is always a good escape for me.
What are some of the things that motivate you?
Again, I think just really helping families and being able to support families that are walking a similar walk or are in a place where we know there are better paths, and they need some support finding the path. And that's huge. That's really motivating to see families, take charge of their journey have the knowledge and the tools they need to do that, and then supporting their children, their youth, their young adults, because it's a long journey. It's a never ending journey for some families that are raising young adults with disabilities and other special needs, especially when they have that foster, adoptive, or kinship family overlay. And I'll just say that kinship, for those who may not be familiar with that term, that's when an extended family member has stepped in to care for a child. It may be a grandparent, an aunt or uncle. It may even be a close family friend, and it may be a formal relationship. It may be an informal relationship. But we have a lot of kinship families in our region, and a lot of them are struggling to find the supports and services that they need to strengthen their family.
Can you tell me about your family's journey?
Oh gosh, sure. So my husband and I formed our family through foster care and adoption. So my oldest and my youngest of three boys, who are now all young men, they're all now 19 to 25. They joined our family through the public foster care system. So in both cases with my oldest and my youngest, we were aware they were in foster care placements when we met them. They were both young. My first was 9 months when we met him, and my youngest, my oldest was 9 months, and my youngest was a little over a year when we met him. And in both cases, we knew there were some special needs, chronic medical conditions, and the effect of trauma and the effect of prenatal alcohol exposure. So we knew those things going in. Nonetheless, it is still a very uphill battle to understand the extent of those needs as they develop and evolve, and support them through early intervention services, through schools, navigating the behavioral health system. It's been a really long journey. I'm glad to say that we have developed some strategies and changed our way of parenting, and changed our approach and used new tools to make connections, find the providers that are going to actually work for them. And I think we're, knock on wood, at a fairly stable place in our home. But it takes a lot of coordination. It takes a lot of juggling. It takes a lot when there are two parents, when we're fortunate to have two parents in the household, a lot of coordination and communication, and a lot of conflict resolution to make that work. But it is really important to our family to keep at it, and really figure out strategies that are going to move us to the next place, even if the current place we're in is really tough. It's a journey.
Yeah, what advice would you give any parents in a similar situation?
Oh gosh, reach out, connect with others that have similar lived experiences. Don't give up, but be realistic. I think about the huge impact that trauma has on some children, on many children, especially children who have been in foster care, who have been in kinship care, who have been through adoption. There's loss, there's grief, there's again the added what we would call intersectionality of disability, plus this conditions that brought them to foster care, adoption, or kinship. So there's a lot, and so I think connecting, learning, being open to the continual new information that may surface, and working openly with your child, your youth, talking about their needs, talking about their preferences, talking about their strengths, building on those strengths, but then also finding ways to help support their challenges.
Where do you want to see the organization, say, in the next 3 to 5 years?
Oh gosh, I would love to reach out to even more foster, adoptive, and kinship families so they know about us. We still are surprised by the fact that we haven't reached everybody that could have benefit from our services. So appreciate this opportunity to share. So I think outreach is certainly ongoing. We definitely like to do a better outreach with our Spanish speaking families. We have a lot of kinship families who speak Spanish, and we want to make sure we're reaching that. So I think that's an area of growth. I think, like in all small nonprofits, diversifying our sources of support is a goal. So we have a lot of grant funding, which we're very grateful for, but it is a continual, chase for those funds. So I think being able to find other ways of sustaining our work and providing a strong operational base is always a goal. So reaching more families, doing more things, and being more stable as an organization are definitely three goals that I can name immediately.
How can people reach out and learn more?
So our website is probably the best first stop, and that's formed, FORMED, families, plural, forward.org. So formedfamiliesforward.org is a great place. We also have social media, particularly Facebook and Instagram. So we invite folks to follow us there. We post things every day. And then we have one of our services is free of charge consultations. So if a family would like to connect with us, if maybe are facing an issue or have some questions, aren't happy with the way that the child's progress is happening or not happening, we can schedule a free Zoom or in-person or phone consultation. And we're really glad to sit down, chart out a plan of action, and share resources and help navigate those services and systems.